Welcome to the Affordable Care Act presentation for the State of Montana Agency Human Resources and Payroll staff. My name is Jackie Dunbar, and I am the Eligibility and Benefit Manager for the Healthcare and Benefit Division. During this training, we will have a brief overview of the Affordable Care Act, or ACA, go over how the state of Montana previously offered state plan benefits, and then discuss how the state of Montana now manages eligibility rules in order to comply with the ACA. When training is complete, you should have a good understanding of the ACA and how your employees become eligible for the state of Montana benefit plan based on the type of position the employee is hired. The Patient Protection and Affordable Care Act, more commonly known as the ACA or Obamacare, was signed into law on March 23, 2010, by the Obama administration. The primary focus of the act was to provide affordable health care coverage to more citizens of the United States by offering tax credits to those citizens who do not qualify for other health care coverage through federal or state programs or employer health plans. Another piece of the law included removing pre-existing condition clauses, removing lifetime maximums, adding requirements to cover essential services, as well as requiring health plans to cover many preventive services at zero cost to the patient. The ACA includes strict requirements surrounding plan member eligibility, including requiring coverage for employees that may have not been previously eligible. These requirements include employers monitoring employee hours to determine benefit eligibility, offering benefits to employees based on their position type, and providing a stability period when an employee moves to an ineligible position with the same employer or reduces hours and is no longer eligible. The ACA also included a tax penalty if individuals were not covered during a tax period. This piece was eliminated by the Trump administration in 2019. Prior to the ACA, the state plan would exclude pre-existing conditions for the first 12 months when an employee became covered on the state plan, unless the member could provide proof of creditable coverage from another health plan. The state plan no longer has pre-existing waiting periods. Dependent children were only allowed to stay on the plan through age 22 and could not remain on the plan if they had health plan coverage or were married. Dependent children are now allowed to stay on the state plan through age 25, regardless of school status, employment status, or marital status. Previously, the state plan had maximum lifetime and transplant limits. We also had annual limits on rehabilitation services, skilled nursing, as well as other visit limits. Limits have been removed, and plan coverage is based on medical necessity. The ACA also added 10 defined essential health benefits. Plans must include in their benefit offers. The state plan already provided coverage for those 10 essential health benefits, including hospitalization, prescription coverages, mental health, and addiction services, so no change was necessary to meet this requirement. The state plan expanded preventive services and now covers all preventive care required by the ACA at 100% of the allowed amount. The state plan also includes an annual $1,000 individual deductible and $25 or $35 copayments in the $4,000 individual maximum member out-of-pocket amount. The ACA requires employers to offer benefits to employees working an average of 30 hours per week. Montana Code Annotated, or MCA, already required state of Montana offer state plan benefits to employees with a work schedule of 20 hours per week. Due to the MCA, the state of Montana does not use the 30-hour average and continues to provide benefits for employees working 20 hours per week or 1,040 hours per year. The state of Montana now determines benefits eligibility based on employee positions, not hours. If an employee is in a benefit eligible position, hours are not monitored and employees remain eligible regardless of hours or leave status. However, hours are reviewed through a 12-month measurement period for those employees in positions that are ineligible for state plan benefits. New employees hired in ineligible positions are measured from their hire date for 12 months. All other ineligible employees are reviewed during the standard measurement period from October through September of each year. If an ineligible employee works over 1,040 hours during the applicable measurement period, benefits may be offered going forward for a stability period. The standard measurement period applies to any active employee in an ineligible position. The standard measurement period is October through September of each year. New employees hired in an ineligible position are monitored retrospectively for 12 months, which is their new hire measurement period. New employees are also included in the standard measurement period. If the employee works 1,040 hours during either of the measurement periods, benefits will be offered for a stability period. Employees determined to be eligible during the measurement periods are guaranteed eligible for 12 months. Employees in eligible positions are not evaluated during the applicable measurement periods. However, based on their measurement period, they are guaranteed eligibility for at least 12 months, regardless of position changes. An ACA stability period is a 12-month period employers guarantee benefits eligibility. Employees in an eligible position are guaranteed ongoing benefits eligibility if they remain employed. If there are no position or employment changes, the eligible employee's 12-month stability period rolls over year to year. Eligible employees terminated and rehired within a 13-week period into an ineligible position will be placed in a stability period and remain eligible through their guaranteed eligibility period. Example, employee is in a benefit eligible position and terminated on July 1st, 2021. Employee is rehired on September 10th, 2021, which is less than 13 weeks. Employee is guaranteed benefits from September 10th, 2021 through September 30th, 2022, which is the stability period. Hours are evaluated during the standard measurement period from October 1st, 2020 through September 30th, 2021. If the employee worked a combined total of 1,040 hours, their eligibility will be guaranteed through December 31st, 2022. Employees transferring from an eligible position into an ineligible position are placed into a 12-month stability period. This stability period begins the month the employee transfers into the ineligible position. Measurement periods still apply, and all hours during the measurement period are included regardless of position changes. Although the state of Montana does not monitor eligible employee hours, eligible employees are still guaranteed a 12-month stability period. This ensures the employee continues to be eligible, and if there are any employment changes, the 12-month period of coverage is guaranteed if the employee does not terminate employment. Once an eligible employee terminates from the state of Montana, their benefits eligibility ends. However, if an employee was benefit eligible prior to terminating and is rehired within 13 weeks into an ineligible position, the employee is placed into a stability period. The stability period generally goes through a 12-month stability period, and then hours are evaluated during the employee's applicable measurement period. Eligible employees transferring to an ineligible position are placed in a 12-month stability period. Hours are also included in the applicable measurement period. Employees placed in stability periods will be evaluated during the applicable measurement periods, and all hours within the measurement period are evaluated. If the employee is deemed eligible based on working over 1,040 hours, their stability period is extended. Prior to the ACA, seasonal employees would lose employer contribution when they went out on leave and would be required to pay the entire cost of the state plan. Because the combined cost of the employer contribution and out-of-pocket contribution was not affordable for most seasonal employees, many would terminate their coverage while on leave and not be able to add their dependents back onto the state plan when they returned from leave. Through audits, if an employee was identified to not work an average of 20 hours per week, they would lose eligibility. Employees that were placed on active duty military leave also lost employer contribution. To ensure the state of Montana remained compliant with the ACA, the eligibility policy was changed to continue employer contribution for any employee in an eligible position, regardless of their leave status. Employees are required to continue paying their out-of-pocket costs while on leave and are billed by the Healthcare and Benefit Division directly. This graph shows how positions determine eligibility for the state of Montana benefit plan. Healthcare and Benefit never advises an agency what position to hire an employee. Those discussions are between the agency and state human resources. Remember, the state of Montana is one employer. If an employee works in multiple agencies, all their hours count to determine benefit eligibility. Short-term recurring and employees in variable positions are evaluated for benefits eligibility based on hours. If an employee works beyond 1,040 hours during their measurement period, benefits will be offered for their stability period. This graph can be found on page 6 of the RAP plan document on the Healthcare and Benefit Division website at benefits.mt.gov. So some important reminders. Refer to the eligibility graph found on page 6 of the state plan's RAP plan document for benefits eligibility. Employees working in a seasonal, less than 6-month position can work over 1,040 hours if the employee does not work over 6 months and there is a 13-week break between seasons. Although less than 6-month employees are evaluated during the applicable measurement periods, their hours do not count towards benefits eligibility unless the employee works over 6 months. If the employee does work over 6 months, their hours count for the entire measurement period. Keep in mind, if the employee is working multiple positions, their hours could count. Variable and recurring positions are ineligible for state plan benefits. Employees working in these positions cannot work over 1,040 hours during the applicable measurement period. Regular, temporary, and seasonal employees working part-time or full-time are eligible for state plan benefits. Hours are not evaluated, and these employees are guaranteed eligibility regardless of hours worked or leave status. Let's go over some examples. Employee A was hired on February 14th, 2021 as a seasonal variable employee, which is ineligible. This employee will be evaluated during the standard measurement period from October 2020 through September 2021 and the new hire measurement period from March 2021 through February 2022. If the employee works 1,040 hours during the standard measurement period, this employee would be offered benefits from January 1st, 2022 through December 31st, 2022. If the employee works 1,040 hours during the new hire measurement period, this employee would be offered continued benefits through February 28th, 2023. Employee B works as a short-term variable worker. This employee is reviewed each year during the standard measurement period, October through September. If the employee works 1,040 hours during the standard measurement period, they will be offered benefits effective January 1st, 2022 through December 31st, 2022. Both employees will automatically be evaluated each year to determine ongoing eligibility. So additional examples, employee C works in a seasonal, less than 6-month position and has worked 1,060 hours. If the employee does not work over 6 months, the employee will remain ineligible regardless of hours. If the employee works over 6 months, the employee will be evaluated the month following and retro back to the beginning of the season. If the employee is deemed eligible, they will be offered benefits effective the following month for 12 continuous months, their stability period. Employee will also be included in the standard measurement period. Employee D works multiple ineligible positions at the state of Montana. Record 0 is a seasonal variable position with the Department of Transportation. Employee works 5 months with a total of 920 hours. Employee terminates on April 15th. Record 1 is a short-term recurring position with Fish, Wildlife, and Parks starting June 17th. Employee works 2 months for a total of 121 hours. Employee goes out on leave on August 18th. During the standard measurement period review, the employee is deemed eligible. There was less than a 13-week gap between terminating with DOT and being rehired with FWP. Employee worked a total of 1,041 hours between both positions. Employer contribution is turned on and benefits offered effective January 1st. Employer contribution is collected from Fish, Wildlife, and Parks. However, if employee is rehired with Department of Transportation, employer contribution will be collected from the agency the employee is actively working. So let's go over some stability period examples. Employee A worked in a full-time regular position and terminated employment on March 31st, 2022. Employee was rehired on May 2nd, 2022 in a seasonal less than 6-month position. Employee is placed in a 12-month stability period. Benefits will be offered effective May 2nd, 2022 through May 31st, 2023. Employee will be evaluated during the standard measurement period, October through September, and if the employee worked 1,040 hours, the employee will be offered continued benefits through December 31st, 2023. Deductibles and out-of-pocket maximums are reinstated if the employee is rehired within the same benefit period. Employee B worked as a full-time seasonal employee and transferred to a full-time variable employee on July 3rd, 2022. Employee is given a 12-month stability period and benefits will continue through July 31st, 2023. Employee will be evaluated during the standard measurement period, October through September, and if the employee worked 1,040 hours, the employee will be offered continued benefits through December 31st, 2023. If any of the positions are benefit eligible, the employee is benefit eligible regardless of what position the employee is actively working. If an employee is on leave in the benefit eligible position or does not record hours in that position, then employer contributions is deducted from the agency that the employee is working regardless of benefit status. Remember, the state of Montana is one employer, so regardless of where the employee is working, all hours are counted. Keep in mind, if an employee is working in a less than 6-month position, those hours will be included if the employee has another position that is not less than 6 months. This is also true if the employee is working in 2 less than 6-month positions and they go over 6 months without a 13-week break between each position. The total hours would be included from both positions. So let's go over some multiple job examples. Employee A is a legislator and works in a full-time regular position. Employee is benefit eligible in both positions. Employer contribution is collected from both agencies based on percentage of hours worked. If employee A goes out on leave from either position, employer contribution is collected from the agency the employee is actively working. Employee B works as a seasonal variable employee for DNRC and a seasonal full-time employee with Department of Transportation. Employee goes out on leave with Department of Transportation and records hours with DNRC. Employee is benefit eligible with Department of Transportation. Employer contribution will be collected from DNRC while the employee is out on leave with Department of Transportation. If the employee continues to work for DNRC and goes back to work for Department of Transportation, employer contribution is collected from both agencies based on the percentage of hours worked. Employee C worked in a seasonal full-time position with Fish, Wildlife, and Parks and a part-time variable position with DNRC. Employee terminates Fish, Wildlife, and Parks on June 30th, 2021. Employee remains benefit eligible through the stability period, which is June 30th of 2022. DNRC pays employer contribution. Employees included in the standard measurement period from October 2020 through September 2021, and if the employee worked 1,040 hours, the employee stability period is increased and will end December 31st, 2022. What if an employee is offered benefits but does not enroll? Whether an employee is offered benefits through a measurement period, stability period, or just based on their position, the employee is not required to enroll. Keep in mind, we still collect employer contribution from the agency regardless whether an employee enrolls in benefits. What if an error was made? If benefits should have been offered, we go back and collect employer contribution from the agency retro to the eligibility date. We also send out a benefit offer letter to the employee. If the agency placed an employee in a benefit eligible position in error, the agency will need to correct the position and we will add a stability period to the member's record for 12 months. Remember, if benefits are offered, employer contribution is turned on. The employee will also be evaluated during the measurement period. If an error is made and the employee does not enroll, we are able to turn employer contribution off going forward. We will not turn employer contribution off retroactive. What happens if the state of Montana is found out of ACA compliance? The state of Montana must follow federal ACA rules to avoid a $36 million penalty. We take the ACA regulations seriously and have implemented strong internal requirements to ensure we are offering state plan benefits to all eligible employees. We do realize we have a diverse work population, and trying to keep up with your agency workforce needs and budget constraints can be difficult. Remember, we are available to assist you with any questions you have surrounding the ACA or State of Montana benefit plan. So let's talk about the Form 1095-C. Under the Affordable Care Act, self-funded employers like the state of Montana are required to report annually all benefit-eligible employees to the IRS using Form 1095-C. In addition, employers must provide a copy of each employee's individual Form 1095-C annually. Form 1095-C provides the IRS with monthly eligibility information for each eligible employee and their covered dependents for the prior calendar year. Form 1095-C must be sent to the IRS and provided to the employee prior to March 31st for each year. The penalty for failing to meet the March 31st deadline is $280 per reporting failure. For the state of Montana, that means we would have to pay over $3 million penalty if we miss the deadline to report to the IRS, and another $3 million penalty if we did not provide employees with their individual 1095-C. The state of Montana has met the deadline for submission of Form 1095-C since the inception. So for Form 1095-C for the employees select their document delivery preference for their Form 1095-C in the state plan's eligibility portal found on the HCBD website at benefits.mt.gov. The employee's Form 1095-C includes coverage information for the eligible employee and enrolled dependents for each month of the calendar year eligibility was in place. Please note, Form 1095-C is not required to file federal tax returns. The form is for the tax filer's records and may be requested by the IRS if the employee is ever audited. If you have any questions about this presentation, please contact me directly at 444-0380 or jdunbar2@mt.gov. If you have questions about the State of Montana Benefit Plan, contact the Healthcare and Benefits Division at 1-800-287-8266 or email benefitsquestions@mt.gov. Thank you for attending this presentation. This presentation will remain on the Healthcare and Benefit Division website at benefits.mt.gov/publication.